The United States is now seeing a rapid increase in coronavirus cases. Concerned residents have wiped out grocery store shelves, and companies have configured work-from-home plans. On Wednesday night, American President Donald Trump announced heavy travel restrictions from Europe to the US, barring non-nationals not involved in coronavirus research from entering. Passengers who have traveled to China or Iran are also facing restrictions from entering the US. This comes amid growing numbers of cases in the US. Globally, there are over 167,000 cases and 6,606 deaths, according to the World Health Organization. Currently, China has the most confirmed cases with 81,000 cases. However, Italy and Spain are close behind. Here in the US, we have over 1,600 confirmed cases and over 40 deaths. Medical systems have scrambled to meet the testing and treating demands. Washington State, which now has 267 confirmed cases, was ground zero for the virus in the US. Providence St. Joseph Medical System, which treated the first COVID-19 patient in the country, has been preparing for the pandemic. In a webinar with HIMSS Media, the team discussed its efforts to prepare for the virus, sorting them into 3 buckets: triage, test, and treat. The system put together a chatbot to help patients configure their next steps. The chatbot also links to on-demand telehealth visits and nurse hotlines. This isn't the only chatbot addressing the outbreak. Buoy Health added a new feature providing patients with information about the condition. When people are using Buoy's symptom tracker, it may also list possible conditions for certain patients based on travel history and factors. Digital health companies 98.6 and BrightMD have also introduced coronavirus screenings as part of the algorithm. The health system is also taking a cue from South Korea, and Providence plans to open drive-through testing units. Tech is also coming into play with the actual care of patients. Providence is sending patients in the emergency room home with thermometers and oximeters to monitor themselves using telehealth, and is also giving patients who do have to go to the hospital tablets in their hospital room in order to communicate with the outside world. We are also seeing a wave of innovation around the virus from the tech community at large. These innovations include everything from Singapore's Virtus Laboratories developing a rapid test kit to Johns Hopkins mapping system. Governments have also developed tools for addressing the virus. In China, the country most impacted by the virus, the government has released a new app intended to help citizens check whether they came into contact with the virus. App users are asked to register a phone number, name, and ID number in order to see if they came into contact with someone infected. In the UK, the National Health Service has launched an emergency feature to its hotline in order to help people get advice about the coronavirus. The NHS has also announced its plans to set up a unit to counter the online spread of inaccurate and false information relating to the coronavirus. Social media giants are also pledging to curb misinformation. In February, Facebook announced its plans to remove misinformation about the disease on Facebook and Twitter. Social media has also emerged as a place for experts to share information. So far, we've seen healthcare providers share everything from disease maps to dispelling racist myths about the virus. In Spain, Dr. Yelton Chen has taken to Twitter to share his personal experiences living with the disease and showing daily scans of his lungs. As the virus continues to spread, the industry makes it clear that there is still much to be done and much to be learned.